This is Dr. David Albert from the Digital Health Summit here at CES 2019. And it's my honor to interview Dr. David Caraway of NEVRO. And he's going to talk to us today about something really important, how to potentially deal with some of the issues around the opioid epidemic. David, thank you, welcome, and tell us about NEVRO.
Well, thanks, Dave. Nice being here. Thank you for the invitation. So NEVRO is what we would refer to as a neuromodulation company. We make devices that interact electrically with the nervous system to treat diseases and in particular chronic pain. And this idea of neuromodulation is we modulate these electrical signals and change the way the body perceives pain and or interact with disease processes. Our company is relatively new in the US space. There's 3 large incumbent manufacturers that have been here long before us and are much larger, but we're a very focused company on neuromodulation. We've been in Europe for about 7 or 8 years. We've been FDA approved based on our pivotal study since late 2015. And we scaled up really rather dramatically over the last 4 years here in the US.
Well, wonderful. I know, people here are familiar with TENS, non-invasive neuromuscular stimulation. Tell me about the procedure and the issues related to how do you deal with, what kind of pain does your treatment deal with?
Right, so the typical example, the prototypical example that we deal with would be back pain and leg pain, often after previous spine surgery that's really not done the job that it needs to do. People call this failed back surgery syndrome. It's not really a very good name, but that's a common term for it. So most of the studies that have been done in years gone by looked at treating the leg component after failed back surgery. Most of those folks would have pain in the buttock down the leg called radicular pain. And most of the spinal cord stimulator devices that were studied treated that with about 50% of patients getting about 50% pain relief. We came onto the market with a different study. We went after both the axial back pain, the middle of the back pain that happens after this, as well as the leg pain. And we demonstrated through a large-scale randomized controlled trial against another active treatment, one of the current devices in the market, superiority in pain relief, as well as the unique issue about our therapy, which is we don't create paresthesias. And I want to spend just a second telling you about that. So for the last 40 years that these devices have been used, the idea was you create paresthesias, these tingling sensations where the patient has pain. So if they have pain in their buttock or their back, you've got to get these tingling sensations, and that changes the way the brain perceives that pain. It's so-called gate theory. Well, we changed that, turned it all on its head. We don't create any paresthesias. We never create paresthesias. That's not part of our therapy. We operate at a much higher frequency, 10,000 hertz, as opposed to the traditional stimulators, which are far below that, factor of 10 below that, or less, so usually in the range of 60 hertz. So we really changed that, but by doing that, we were also able to show efficacy in the axial component of back pain. And right now, we're exploring other areas of very important pain conditions.
Well, as a pain anesthesiologist, you've obviously done many back injections, whether it's steroids or Novocaine and Xcaine. And so you see this obviously as a much longer term type of therapy. How long do these therapies last? How long will your device last?
Right, so our pivotal trial, really our sentinel study, was published in the Journal of Neurosurgery with 24-month results. Now, we anticipate that the device itself will have a 10-year plus lifetime before the generator needs to be replaced, but we have very good, durable, long-term results. We have real-world data extending out 6-7 years with a very low explant rate due to loss of efficacy. So really we expect this to be very durable relative to other treatment options.
Well, this is the Consumer Electronics Show, so my last question will be, I'm certainly familiar with patient-controlled analgesia. Does the patient have any input here in terms of feedback either to the doctor or to the device itself?
Yeah, so that's a really good point. So patient-controlled analgesia is often about, in the acute setting, pushing a button.
Sure.
And in the chronic setting, unfortunately, about taking pain pills. And what we know is there's no evidence behind that, and we've seen all the societal horrific things that have happened since a big push was on to use opioids to treat chronic pain, which has never been demonstrated to be useful. With our device, the device gets placed. They have a trial, a temporary placement of the device. We don't move on to an implant unless they have a very good result from the trial. Once that is done, and if they have a very good result, there's a permanent device that's placed, the patient gets to program it, turn it on and off and up and down as they see fit. With our device, they tend, because they don't feel anything, they tend to just let it run 24 hours a day. Ours is the only device that's approved for use while you're driving, operating heavy equipment, and all those types of things. So our patients just use it. But they do have control over it with a handheld programmer.
Well, that's very exciting. David, thank you for coming. Again, Dr. David Albert from the Digital Health Summit at CES 2019, and Dr. David Caraway from NEVRO. Thank you.
Thank you.